There's nothing like mac and cheese to warm you from the inside out, right? We've got the pharmacist from Shoppers Drug Mart, Victor Wong, here. He's going to teach us all about how to find our heart age. There's a fabulous calculator now online. We'll talk about that in a second. Talk to me a little bit first about heart disease and Canadians. How prevalent is it here in Canada?
Right, yeah. Thanks for having me, Val. So heart disease is one of the leading causes of illness and death in Canada.
Still, eh?
It is, yes. With 1.3 million Canadians diagnosed with some form of heart disease, whether it's heart attacks in the previous past or strokes, it is one of the leading causes. And more alarmingly, every 7 minutes has been shown that there's one Canadian who's died of heart attack or stroke.
Every 7 minutes?
That's correct, yes.
Wow.
It is very, very alarming.
No kidding. My uncle just died of a stroke recently.
Oh, my
so there
condolences.
you go. And my mother-in-law just had a small one, so it's definitely happening. What are some of the things that are causing the heart disease to happen?
Right. Well, it's a lot to do with our current lifestyle. A lot of us have a very sedentary lifestyle, so we oftentimes sit most of the times during the day. We eat a lot of processed foods, fatty foods, and a lot of people smoke, even despite all the warnings in the media.
Still?
Yes. So, a lot of things to watch out for. And the heart health calculator and the heart age calculator is one tool, and it's a first start for a lot of individuals to know their current risks and allows individuals to be able to see their heart age relative to their actual age.
So we go online, there it is there, and once we press the start button, what happens?
Right, so pressing the start button starts the actual questionnaire, and it's a series of simple questions of items that are prognostic for your risk of heart disease. So in that case, you can see that there is your gender, your height, your weight, your age, as well as other lifestyle factors. So for instance, your activity level and your family history, and also any concurrent medical diseases that you may have. All of those factors are indicators to your heart health and other risks that you may have.
So if someone in your family has died of a heart attack before, say, 65, that might give you a greater risk?
That's correct.
That's
Family
not
history.
fair.
It isn't.
It's not fair.
It isn't, yeah. But it's important to know, because if you know the risks, you can make active changes to your lifestyle to address them.
One of the questions it asked me had to do with blood lipid levels.
Right.
I happened to have had a blood test taken fairly recently, so I had those numbers. What if you don't have those numbers?
Right. So that's okay. There's actually an option on the questionnaire that allows you to click I don't know. And that will default to the average level. Or you can also select whether you think you're on the average level or the high risk or the low risk level. So it does default to those answers as well.
Oh, good. Oh, good. So you can still get a good calculation even if you don't have all those specifics.
Right, a fairly accurate one.
Okay, it's because it asks for LDL and HDL and cholesterol.
Exactly. It also asks for your blood pressure. So, for instance, your systolic pressure. So, ideally, an individual would ideally have a systolic pressure of under 140 and also a diastolic pressure of under 90 and ideally maybe even 120 over 80. Yeah.
Right on. That sounds good. Okay. Why do you think this is so important? What is the purpose of knowing your heart health age?
Right. Well, knowledge is power when it comes to managing your heart health and managing your health overall. The Cardiovascular Society of Canada actually recommends that everyone should know their heart age and know their risk profile, because studies have shown that if you know your risks, you're more likely to take ownership.
That's true.
And be
And
empowered.
it's right out there in front of you. You've got the information now.
Exactly. That's right. That's right.
I took the test. I'm happy to say my heart is younger than I am.
Ah, very impressive. Nice. Congratulations.
So there, my heart is 40 years old. Isn't that lovely?
Yeah.
So am I okay then? Can I go eat a bag of potato chips now?
Well, maybe in moderation. What this indicates is that your risk of having any heart disease within the next 10 years is less than the average of your peers around that age as well.
Excellent.
And so this chart right here shows the average risk that you may have of developing some form of heart disease. So that's on the left-hand side. That's the bar there. And for other individuals who may not be as fortunate as yourself and who do have above average risk, on the right-hand column, so there would actually be bars there, And it shows
And
that...
it would be indicating what's going on with them.
Right, exactly. And it shows that if you had, for instance, stopped smoking, or if you had modified your blood pressure and reduced it, it would actually show how much risk it has been decreased if you had made those changes to your lifestyle.
Ah, it's so helpful to know that.
It is,
and
yeah.
it's encouraging. I'm encouraged that I've got a good number to keep on doing what I'm doing.
Right, exactly.
But if I had a bad number, then it would be a wake-up call, and hopefully people would act on it.
Yes. I mean, the first step is to seek advice and information from your medical health professional, such as your doctor, your pharmacist, just to see if you're at any immediate risk of having any heart disease.
We've only got about a minute left, so run through some of the quick things we can do to change our habits.
Right. So an easy acronym to remember is being Heart Smart.
Okay.
So S-M-A-R-T. S stands for stop smoking. If you stop smoking, immediately, even after 2 days, your risk of heart attack drops, and after a year, your risk is cut in half.
Brilliant.
Huge. M stands for monitoring your blood pressure. So again, having a blood pressure of lower than 140 over 90. A stands for an active lifestyle. You want to be active. 3 to 5 days a week, 30 minutes of exercise, running, walking, curling, swimming, doesn't matter. Just be active. R is regulating your cholesterol levels. Again, as you mentioned, have good numbers there. And T is take control.
There you go.
Be empowered. Take control of your lifestyle, ask the right questions, and make sure you're surrounded by individuals that will encourage you and support you on your
Go
journey.
to shoppersdrugmart.ca. My Heart Age. Do the test today. Thank you so much.
Thanks so much, Val.
When we come back, spring fashions. Woo-hoo.